a nice chat with Dr. Karam. And please, as you join, start looking at what questions would you like to ask Dr. Karam so we can accumulate the questions. And قبل ما رح أعرف عنك توني رح هيك ندردش سوا بس لنشوف الناس عم بيطلعوا معنا. بدي أسألك أول شيء عن الوضع يلي نحن فيه هلأ بالنسبة للكوفيد 19 بالنسبة للبريغنانسي واللاكتيشن هو وضع كتير صعب علينا كلنا بس ما بعرف قد ايه اليوم بدك توضح لكل النساء الحاملات يلي هو والمرضعات يعني أكيد كيف فيهم يتعاطوا مع هذا الموضوع قد ايه في أبحاث عن هذا الموضوع وقد ايه رح نحكي مطولا عن هذا الموضوع. هلا بدي أعرف أول شيء عن دكتور كرم. دكتور كرم is a doctor in gynecology and obstetrics from the University of George Washington هو ال MD الinternship and residency from MCP Hahnemann University Allegheny General Hospital Pittsburgh USA. And he has done a lot of postgraduate work in cancer research in George Washington University, infertility postgraduate research in MCP Hahnemann Allegheny General Hospital, and work on gynecology, oncology postgraduate junior fellowship in MCP Allegheny General Hospital. He belongs to several professional societies like the AMA, the American College of Obstetrics and Gynecology, ACOG, the American Society of Reproductive Medicine, Phi Sigma, Honor Medical Society, William Beaumont Honor Society, and Franz Liszt Society. He has been given several awards in 1998, 99, 2001, 2000, and 2002. As a solo practitioner in Lebanon. He has been working in Lebanon since 2002 between Trad Hospital and Clemenceau Medical Center, Bellevue Hospital, Clinique du Levant, and Middle East Institute of Health and Rosaire Hospital. And a twist to all of this is Dr. Karam is a musician that started playing the piano at the age of 3, and he gave solo piano recitals at the age of 5. And he has given a lot of recitals in Lebanon and overseas, including UAE, Europe, and the United States, and won multiple piano competitions in Lebanon and United States. And the most recent concert was in December 2019 at the Peoria Riverfront Museum, Illinois, at the 500th Centennial Exhibition of Leonardo da Vinci. I welcome you with us today, and thank you for your time, and thank you for all the information that you are going to provide, and for your service also as a healthcare provider for you and your wife in this very difficult times for you as healthcare providers. Starting first, Tony, I would, and excuse me for calling you Tony because Tony is a very dear friend of mine. Him and his wife are dear friends of mine. So does COVID-19 affect pregnant women differently than non-pregnant women?
Well, first of all, thank you for the introduction. And I also treasure your friendship. And thank you also for being among those of us who are always available for our patients. COVID-19, basically it affects everybody, right? But when it comes to pregnant women, a lot of people are afraid or are concerned, and they think that if somebody's pregnant, they're going to be affected a little bit differently than others. The actual response to this has to do with age group. Okay, so most people who are pregnant are going to belong to an age group that is somewhere between ages, let's say 16, 17, 18 at the lower end, up to age 45 at the highest end, with minor exceptions here and there. So this age group is going to be affected exactly like a non-pregnant state. So let's talk about the non-pregnant state. In a non-pregnant state, you get COVID-19. In this age group, most of the time, it's not symptomatic. Most of the time. It's about 90 to 95% of the time, you won't even know that you have it. But if you do have some symptoms, it's going to be a little bit of fever, a little bit of loss of taste or smell, and some fatigue, maybe a little bit of shortness of breath, just like any other flu. I'm not undermining COVID-19, but that's the reality. In pregnancy, going back to the question, is the immune status of a pregnant woman differently than a non-pregnant woman? The answer to that is that it's yes and no. In most cases, it's the same. In some cases, and that has to do with the medical conditions that the pregnant woman has already, that can affect the fact that your immune system is a little bit lower in response, and poorer in response, or it's over-responding. In that specific case, then COVID-19 becomes an issue. But other than that, in 95 to 99% of cases, it's going to be the same. Does that answer your question?
Yes, it does. So you mentioned those cases where the woman has an immune response that is lower in pregnancy. Can you cite some cases, some conditions?
Yeah. If, let's say, you're a pregnant woman who has, let's say, blood pressure problems or diabetes, let's say, okay? Let's say diabetes, it's easier. So in diabetes, your immune system is going to respond a little bit differently than in a non-diabetic state. So that specific pregnant person is going to respond to COVID-19 in a poorer way than somebody who's generally healthy. That's one example. Another example has nothing to do with the immune system. If, let's say, you have a pregnant patient who has a coagulation problem in the blood, that becomes an issue because COVID-19 has been linked to increased thrombosis in people. Thrombosis means blood clotting, for those who don't know. So if you are somebody who has this tendency, more so than others, and you're not being treated for it, or you don't know that you have it, because most pregnant women are not screened for that unless there's a problem. And therefore, you become more susceptible.
Okay.
In general, I have to say this to be clear, in all of this hoopla of COVID-19 from October, November until today, there hasn't been enough cases of pregnant women that have been admitted, diagnosed with COVID-19, enough for us to say, scientifically speaking, that there is a significant difference between the non-pregnant or pregnant women. But we know in general that most numbers that are reported are not the real actual numbers. These are the people who have been tested. So let's say in Lebanon, they tell you there's, I don't know what's the number today, but let's say 800 people. That doesn't mean there's 800 people with COVID-19. It means those are the ones that tested positive, but there might be 500 who are positive who have never been tested. Blah, blah, blah. Same thing in most countries. So we will have this data, but it will come in a year or so.
All right. So if a woman is pregnant and gets COVID-19,
yeah.
So any special considerations?
Look, in anyone who gets COVID-19, in this age group, the concern is not them, the concern is the people around them. We have to put this into consideration. So in a pregnant state, somebody comes in testing, she has all the symptoms, you test her, PCR is positive, you have to isolate her. You have to make sure that she wears the mask and gloves and all this stuff, basically not for her, but for her not to infect others. Okay.
Mhm.
And for you to treat this person, you have to treat them supportively, like you do in a non-pregnant state. What does that mean? If there's fever, you lower it. If they're dehydrated, you hydrate them. You make sure they're not fatigued, overly tired, and all that stuff. If the condition gets worse, just like in a non-pregnant state, you have to support with providing oxygen and providing, the oxygen supply, let's say, not necessarily intubate, but if you get to that, then it's a bad case, and that's rare in these age groups. So we don't really worry about it that much. Hygiene, hand washing, the regular
Usual.
isolation, which becomes mentally draining more so for a pregnant woman than a non-pregnant woman, because she's already at an altered mental state, if you wish, and I mean that in a good sense, not in a bad sense. Okay, so it's more of a supportive care than anything else.
Okay. So how about newborns? Are they
Interesting
affected?
question. Look, let's talk children all the way down to newborn. All over the world, the number of cases of infected children is very low. And even those who got infected, they got over it so quickly. There are sporadic reports here and there of a child not making it because of COVID-19. But after further investigation and after the news was out, people continued to research and do their research on these kids that were affected. And it almost always turned out that they had some sort of a major problem, like leukemia or something like that. Okay.
Oh.
So in children, it's not a concern. Let's go to the newborn now. First of all, the real question is, let's say a pregnant woman has COVID-19. Will she transmit to her baby what we call vertical transmission, meaning through the placenta from her to baby? There are not enough data at this point in time to say 100% that that's not going to happen. But I
Mhm.
can tell you from our experience with other viruses, and I don't mean any virus, I mean from the same corona family virus, because of the molecular biology of how this works and how they cross placenta. And I'm not going to go into all the details now, unless if you want me to, I can. But it's very interesting. And as a microbiologist in background, I love this stuff. But the idea is, it's not easy for anything to cross the placenta to begin with. There are rare viruses that do that, okay, like CMV and herpes and stuff like that, but those are rare. And the way they do it, many times they don't affect the baby, except in virulent viruses, which COVID-19 is not to kids or to newborns. So we shouldn't worry too much about that. There has been a couple of reports in England, for example, and China. The baby was delivered, baby was found to be COVID-19 positive, mom was positive. Well, it's not that it got through the placenta, it's probably in the air and the coughing and the pushing and all that. So you catch it. So what? If you're PCR positive, it's not going to affect you. So what? It's not a big deal. And all these kids, they did well. They monitored them in the ICU just out of fear, but not because they needed it.
So anyways, with respect to kids, and I do understand from the research that we are hearing that because of the kids' immune system, the fatalities of kid is almost non-existent in COVID-19.
Correct. And there are two theories about this, if you want to go into specifics. Some of them say that it's because the immune system is underdeveloped, so it doesn't mount a big response to COVID-19, which is the case in the older population. But that's just a theory. I mean, bottom line is it's not proven that this is quite what happens. Others say, no, it's because kids have a very efficient immune system that can get rid of things a little bit faster and quicker than in an adult. So it's up in the air at which theory you subscribe to. The good news is, either way, this virus did not attack kids. That would have been a disaster.
How about pregnant lady wearing a mask and gloves when in public? So we hear a lot of things about wearing masks and gloves.
Okay, I have to say this. Gloves, throw them away. They're a waste of money and a waste of time and a waste of everything, basically. And they create waste. I don't know who came up with the idea of the gloves, but that's like the most ridiculous thing. Being pregnant or non-pregnant, people should not wear them, not even in supermarkets, okay? I don't know, that's like the worst thing, because I'm gonna tell you why. First of all, microbiology. Viruses, they stick to latex and gloves much more so than they stick to your hand, right? Number one. Number two, when you're wearing gloves, you tend to break them. They're not designed to be worn 24/7, okay? And therefore, you get cracks, and then if there's a virus, it goes onto your hand, which doesn't get cleaned, and therefore it becomes a mess. Third, you touch things with the gloves, you're creating this viral environment that's amazing. So I don't want to get into more than this, but
So
gloves should be
I'm
thrown
very
away.
happy there, yani.
It just gives you a sense of false security, is what it is. Okay? It's like when you elect a certain politician, you think life is good, and it turns out it's not. Same thing. Okay? So basically, that's what it is. So gloves are out. Now, masks. Masks are not designed to protect you from getting the virus. They are designed for protecting people from you giving them bugs. When we as surgeons wear a mask in the operating room, it's not because I'm worried that the patient's going to give me something. It's because I'm protecting the patient from me. So this is the whole point. Yes, they should be worn in public places, but the idea of wearing them is not to protect yourself, but to protect others from you, should you be a carrier who is not having symptoms. Make sense?
Yes.
Okay. Third thing, on top of masks now, we have those shields. That's the disaster one. People wear those thinking that's going to protect them. Let's say you're wearing a shield without a mask. I was at a supermarket the other day, and the guy cutting the meat behind the counter was wearing this shield, no mask. But this shield now is directing the virus onto the meat. If he has it, we're dead. So that's bad. The shield plus the mask, if you have the virus, could be beneficial for people who are around.
Mm-hmm.
Okay? Now, masks, they come in different kinds. There's the surgical mask, the regular one, and there's the N95 that everybody's talking about. Try wearing N95 for more than a couple of hours. It is the worst thing ever. You will stop breathing. It will make you dizzy because it will accumulate CO2, blah, blah, blah. So these are not for everybody. These are strictly for healthcare workers or people who are in places where they have to be in confined areas with people who could be infected or if they are infected. Okay?
So what I'm hearing is definitely a pregnant lady shouldn't be wearing at all either a mask or a glove. This is
Well, not a glove for sure, not a shield for sure. Masks when she's in public, that's fine.
okay. How about home births and hospital births? People are really scared to go to hospitals nowadays.
Excellent question. Let me tell you something. For people who are, promoting that home birth should be, now coming back, that's the worst advice. You are much safer in a hospital, even if there are patients with COVID-19 there, than a birth at home. Of course, not from a viral perspective, but from a safety perspective to the woman. People who are having home births, going back 50, 60 years ago, that was a natural thing for people to do. But it was a natural thing for someone to have 6 babies and lose 2 or 3. So we don't want that. Having a birth at home is one of the riskiest things you'll ever do. Now, I know that some people who are proponent of this are gonna not like what I'm saying, but medically speaking and statistically speaking, people have more problems at home. What if there's bleeding? What if something happens to be? What if heartbeat goes down? You need to do a C-section, blah, blah, blah. You're gonna lose that pregnancy or you're gonna lose mom or both. So that's not a good thing. Hospitals are not scary. I have to say something for the Lebanese audience, okay? We did a fantastic job, probably much better than most countries. And I'm not saying this, I don't like to give too much credit to the Lebanese, but they did a fantastic job. And most hospitals created like a different hospital within a hospital for COVID-19, even for pregnancies. So it is a very, very safe environment. And remember, your doctor is there, meaning your doctor is exposing themselves to this environment and they're coming back home, that means that it's actually really safe. So people should not worry about that. Now, speaking about worldwide, okay, again, the medical teams worldwide, except in areas that were overwhelmed by number of patients, they actually did a fantastic job at trying to maintain a certain safe environment for people to come and get pregnant. They modified some protocols, maybe calling a C-section earlier than what you would normally do in order to facilitate a quick delivery and not expose people for the virus if the patient has COVID-19, because in an operating room, you can control things much better than in a delivery room. People have done that, and those are twisting the rules and bending the rules a little bit. But for the patient, for the sake of the patient, they should always trust that going to a hospital, going to their doctor is the best choice.
Okay. How often do we do the PCR test for a pregnant woman?
I've been asked that question a lot. What I do is the following. I don't screen everybody. And much like you do a history and before you do a physical exam on any patient, you look at the case by case, okay? Let's say a pregnant patient comes to me in her 3rd month, okay? But she was recently in Egypt. Well, I'm gonna test her. I'm gonna test her for her, I'm gonna test her for me, okay? So if she's negative, I'd repeat it in a week or 2 because PCRs can be negative at the initial phase of the infection, right? If after 2 weeks she's negative and she hasn't been exposed and she's in a good environment where she's taking all the precautions, then she does not need to be tested at all. She comes back to me at the 6th month with a fever and shortness of breath, I'm testing her. Although I don't think it's COVID-19. But because this is a pandemic and it's spreading and it has a high spreading rate, then I'm obligated to check. Before entering the hospital, I am checking everybody. And in some hospitals, that's became mandatory. In others, it's not. But I do think that it should be. Even if it's not 100% accurate, it should be done. If not for the patient, again, it's for the healthcare workers that are going to be taking care of you at the hospital. So I test everybody before sending them to the hospital, and we go from there.
Okay, all right.
And I'm talking about PCR, by the way, okay? There's also the other testing, which is the IgG, IgM, IgA, what they call sometimes as a rapid test, although it's not really that rapid, but that's what they mean. This gives you a sense of where you stand regarding, have you been exposed to it before? Do you have some sort of immunity to it? We can't say truly that you have immunity to COVID-19 if your IgM or IgG is high, but we say that at least you're better protected than someone who hasn't been exposed. So that helps us in the decision. It's a multifactorial thing. It's not just one thing. Okay.
So you do either or you do.
It depends on the situation. It depends on the scenario. If somebody comes in from, let's say, never traveled, not exposed, not anything, with a slight fever, I'll just do the PCR. Repeat it in a week, and end of story. But somebody who may have been exposed before, who has had fever but doesn't quite know, blah, 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 I might do both. Doing one is, some people are promoting that we should only do the rapid test and forget the PCR. That's wrong. You need both to have information that's complete.
Okay. What if I am immune? Should I take any less precautions?
Again, let's not say you're immune. Let's say your IgG, IgM is high, meaning, they're high now, but in a few months, we don't know how they're going to go down. So yes, you would take less precautions, meaning it's not you stop wearing masks, but you might be somebody who can easily go to work. This is what happened in Germany. This is what happened in South Korea. In Germany, they tested everybody for immunity, and they gave certificates. If you have the certificate, you're free to move around. If you don't, you should stay at home, okay? They didn't go by license plates, for example, odd and even. That's ridiculous. But the idea is you go with something scientific that makes sense, okay? They didn't tell people stay at home after 7 because the virus is only active in the day. These are, I know I'm criticizing a little bit policies, but the idea is we have to be rational about what we do. Okay, when you do things, you have to do it based on scientific data. So yes, if I have somebody, let's go back to the question. I have somebody who's pregnant, who has, immunity, let's call it, quote unquote, then yes, I would tell her, look, go and visit your friends. No, it's okay. And go into the grocery store. Don't be too scared. Okay, that's the answer.
How about breastfeeding? We haven't talked at all about breastfeeding and COVID-19.
Under all circumstances, breastfeeding should not be stopped. Okay, it's something that you should do. All data, WHO, American College, Royal College of England, those are the top, all of them, they promote breastfeeding, and all of them have studied from the limited amount of cases that they've had, if the virus goes through breast milk, and it doesn't, so far it doesn't show that. Can a baby catch COVID-19 while breastfeeding from a mother who has COVID-19? Yes, because of the breathing, not because of the breast. So wearing a mask, by the way, is not totally protective for others if you don't wear it correctly. And I can tell you, even if you bring the best surgeons out there who spend most of their day wearing masks for other reasons, most of them won't know how to properly wear a mask. It has to be worn in a certain, it's not easy to wear a mask the proper way. You have to have it fit all around. And some people wear a mask, I see them sometimes, they cover the mouth, they forget the nose. That's ridiculous, okay? Or they have, gaps on the sides or from the lower end. It's not easy, they get loose. Even if I'm doing surgery for 3 hours, after the second hour, they loosen up. So it's part of the game. That's why N95 doesn't loosen up, but it makes you dizzy. So there's a price to pay somewhere.
Yeah, it makes you dizzy, definitely, because it accumulates the CO2.
Exactly.
If well fitted.
Exactly.
So from my understanding of everything you're saying, really, with pregnancy, it is really up to the woman and her immunity, and how is she coming from, or if she is diseased already, or if she has problems in the first place. And this is where we need to look at
Right.
the situation much more. And in
And they
lactation,
shouldn't worry. They shouldn't worry.
yeah, they shouldn't worry. Well, I need to thank you a lot. It doesn't seem we have questions. It seems you have covered the material really well for people to understand. I really thank you for your time and for all of this information. There were many people that reached out to me asking me about this specifically, and I really didn't have many answers to them. I'm sure you have clarified a lot. So thank you for your
No
presence.
problem. If anyone has further questions, they can contact me. You can give them my contact.
Okay, have a wonderful day, rest of
You
the
too.
day, and see you soon. Take care.
You
Bye.
too. Thank
Bye.
you. Bye.
Record.